Judith was a 69-year-old retired social worker who spent her entire career helping others navigate life's challenges. She was independent, RP, and proud of her ability to manage everything on her own. But one Tuesday evening, as she got up from her favorite armchair to answer the phone in the kitchen, she didn't notice the magazi, any that had slipped onto the floor one step. One moment of not looking down, and suddenly she was on the ground with a fractured wrist that would take months to heal, according to the Centers for Disease Control and Prevention. About 3 million Americans aged 65 or older are treated in emergency departments for fall-related injuries every single year, and here's what might surprise you. Most of these falls don't happen on icy sidewalks or uneven outdoor paths. They happen right at home, in the places we know best, on the floors we walk every single day. Imagine if there was one simple habit, something so easy you could start using it tonight, that could significantly reduce your risk of falling indoors. A habit that takes just a few seconds, but could preserve your independence, your confidence, and your peace of mind for years to come. Welcome to Senior Health Facts, your trusted home for science-based health education, as in specifically for adults over 60. Today, we're going to explore that powerful habit, why it matters more than you might think, and exactly how you can make it part of your daily routine. Starting right now. If living safely and independently in your own home matters to you, go ahead and hit that subscribe button. Let's dive in. As we move past 60, our bodies go through natural changes that make falls more likely and more dangerous. Our balance systems become less responsive. Our muscle strength gradually declines, especially in our legs and core. Our reaction time slows down, meaning we have less time to catch ourselves if we start to stumble, and our vision often changes, making it harder to see obstacles, especially in dim lighting or when moving from bright rooms to darker hallways. These aren't signs of weakness, they're simply part of the aging process that affects every single one of us. But here's what makes this so important. Your home, the place that should feel safest, can actually become one of the most hazardous environments if we don't adjust our habits. Research from WashU Medicine, Health Partners, and Mayo Clinic consistently shows that the majority of serious falls among older adults happen indoors. We're talking about falls in the bathroom, near stairs, in hallways, or in dimly lit rooms where we've walked 1,000 times before. The National Institute on Aging confirms that familiar floors can be just as risky as unfamiliar ones, especially when we let our guard down because we think we know every inch of our age. The consequences of these indoor falls go far beyond a few bruises. We're talking about broken bones, particularly hip fractures that can take months to heal, head injuries that can have lasting effects, reduced mobility that makes it harder to do the things you love, and perhaps most heartbreaking, a loss of confidence that makes people afraid to move around their own homes, leading to isolation and further physical decline. But here's the encouraging news that should give you hope today. Studies show that many indoor falls can be prevented by addressing just one or two simple habits. One community-based program studied by Washington University School of Medicine reduced in-home falls by nearly 40%. 40%, that's not a small improvement. That's potentially thousands of people who maintained their independence, avoided painful injuries, and continued living the lives they wanted. So the habit we're about to discuss isn't just a nice suggestion, it's a meaningful, scientifically supported practice that could make the difference between staying active and confident in your home or facing the physical and emotional challenges that see. After a serious fall before we get to the solution, let's talk about the common mistakes many of us make without even realizing it. These are the habits that quietly increase our fall risk every single day. Mistake number 1 is moving through your home in low light or dimly lit corridors. When you can't see clearly, you can't spot the obstacle, that rug edge that started or curl up, the charging cable stretched across the hallway, the pair of shoes you left by the bedroom door. In good lighting, these are easy to see and step around. In dim light or darkness, they become invisible tripwires. Mayo Clinic emphasizes that poor lighting is one of the most overlooked but significant risk factors for indoor falls among seniors. Mistake number 2 is leaving clutter or loose rugs in your daily walking paths. Many of us think that because we walk the same route every day, from bedroom to bathroom, from kitchen to living room, we don't need to worry. Why about what's on the floor? We tell ourselves, I know where everything is, but the reality is that small things shift. A pet toy rolls into your path. A throw rug slides slightly on the hardwood floor. A bag gets set down in a spot where you normally walk. Familiarity can actually work against us because it makes us less vigilant. Mistake number 3 is not adjusting your environment when your vision, balance, or mobility changes. What worked perfectly when you were 55 may not serve you well at 65 or 70. If you've noticed your balance isn't quite as saint, if you need glasses more often, if you've had a medication change that makes you feel a bit dizzy, your home environment needs to adapt along with these changes. Ignoring these shifts and continuing with the same setup is like trying to use a prescription from 10 years ago. Mistake number 4 is relying on memory instead of actively checking before you move. We often operate on autopilot in our homes. We get up from a chair or bed and immediately start walking, trusting that we know where we're going and that nothing has changed. But this autopilot mode turns off the visual scanning and physical awareness that could catch a potential hazard before we step on it. Mistake number 5 is ignoring the pause and scan habit when moving between rooms. This is especially risky when the lighting changes from one room to another, or when the floor surface changes from carpet to tile to hardwood. These transitions are when falls often happen because our eyes and our balance system need a moment to adjust. But we don't give them that moment. Have you recognized yourself in any of these mistakes? If so, you're not alone. Most of us do these things because they've become automatic over the years. But the good news is that with one simple new habit, we can address all of these risks at once. Now let's get to the heart of today's message, the habit that can change everything. Here it is. Pause, look ahead, and ensure the path is clear right before you step. That's it. 3 words that take 3 seconds. But those 3 seconds could prevent a fall that changes your life. Let me break this down into practical steps you can start using today, building from the smallest micro habits to a complete home safety system. During week 1, you'll be building the foundation. With micro habits, micro habit 1 is this. Every single time you stand up from sitting, whether it's from a chair, your sofa, or the edge of your bed, take 1 extra second, just 1 second. Look at the floor between where you are and where you're going before you take that first step. This simple glance gives your brain the information it needs and gives your body a moment to stabilize. Before you start moving, Micro habit 2 is to install a small light or night light in your bedroom and hallway tonight. Not tomorrow. Tonight. Hui. And you get up in the middle of the night to use the bathroom. You should be able to see your path immediately without fumbling for switches in the dark. Motion sensor night lights work beautifully for tea. Is because they turn on automatically when you move. Micro habit 3 happens before you walk from one room to another. Ask yourself one quick question. Any obstacles? It takes 2 to 3 econs to do this mental check. Rug edges, shoes, a bag, your pet's toy. This mini audit becomes automatic after just a few days of practice. During weeks 2 through 4, you'll be building and G up your safety system. Now that you've established those basic habits, it's time to expand them into a complete approach. Action 1 is to create what I call a safe walk path in your home. This and identifying the routes you use most often during your daily movement: bedroom to bathroom, kitchen to living room, front door to bedroom. Walk these paths and make a commitment that these routes will always be clear, well-lit, and free of slip or trip hazards. This isn't about changing your whole house. It's about securing the paths you use 10 or 20 times every day. Action 2 is to set up lighting triggers throughout your home. Place a motion sensor night light in the hallway. Keep a small lamp near the doorway so you don't have to walk through darkness to reach the and light switch. If you have a smart home system, program your lights to come on automatically during evening hours when you're most likely to be moving around. Action 3 is to do a weekly time check. Once a week, walk your main paths and look for anything new or changed. Has a rug shifted? Is there a new cable running across the floor? Did someone move a piece of furniture slightly into your walking space? The moment you spot something, remove it or fix it. Don't wait. Action 4 is to pair your pause look ahead habit with daily activities. For example, before your next meal, when you walk to the table, pause. Scan the path, then go. Before you walk to answer the phone, pause, scan, then move. By linking this habit to activities you already do every day, it becomes automatic much faster. In month 2 and beyond, you'll advance your safety practice. Advanced step 1 is to ask a family member or a trusted friend to walk through your home with you. Sometimes we become so used to certain hazards that we literally don't see them anymore. A fresh pair of eyes can spot the rug that's become a tripping hazard, the dim corner that needs better lighting, or the shelf that's positioned right where you might bump into it. Advanced step 2 is to upgrade your lighting throughout the house. Install brighter bulbs in key areas, add night lights in multiple locations, not just one. Consider glow in the dark switch covers in hallways so you can find the light switch even in complete darkness. Advanced step 3 is to take a hard look at your rugs. If they're loose, either secure them properly with non-slip backing or consider removing them entirely from high-traffic areas. Many falls happen because someone's toe caught the edge of a rug tee. Hat looked perfectly fine but wasn't secured properly. Advanced step 4 applies if you've experienced any mobility or vision changes. Create a daily walking practice. Use your safe path and do one complete loop through your home each day, while consciously practicing the pause scan habit. This reinforces the behavior and gives you a chance to notice if anything has changed in your environment. Let me give you a simple checklist to use over the next 2 weeks. Check off each day that you paused and scanned your path before walking each time you stood up. Confirm that your bed, room, and hallway have a night light or easily Reachable lamp for nighttime movement. Walk your main indoor paths at least once and remove or note any new obstacles you find. Check for rugs, toys, or shifted items along your walking routes and either remove them or secure them properly. Evaluate the lighting along your indoor walkways. Is it sufficient? If not, take at least one step to improve it this week. This checklist isn't about perfection, it's about progress. Each small step you take makes your home safer and gives you more confidence in your movement. Let me tell you what happened to Judith after her fall. After 2 months of recovery, wearing a cast and doing physical therapy, Judith realized something had to change. She couldn't go back to moving through her home the way she used to. So she adopted this exact habit we've been discussing today. She installed night lights in every hallway. She removed to-lose-throw rugs that she walked past for years, and most importantly, she made a commitment. Every single time she stood up, she would pause for just 1 second and look at her path before taking that first step. It felt awkward at first. She'd catch herself starting to walk and have to consciously stop and look down. But within 2 weeks, it became second nature. Within a month, she realized she was moving through her home with more confidence than she'd had in years. Not because she was walking faster or being more careful in a fearful way, but because she'd given herself the gift of awareness. Today, at 69, Judith volunteers at the senior center. Twice a week, tends her garden and babysits her grandchildren. She hasn't had another fall, and perhaps most importantly, she doesn't live in fear of falling. She lives with confidence because she knows she's taking smart, simple steps to stay safe. You deserve that same confidence. You deserve to move through your home with ease, knowing you're doing everything you can to prevent falls and maintain your independence. So here's your challenge starting tonight. Pick just one micro habit from what we discussed today. Maybe it's installing a night light. Maybe it's doing one pause and skim before you walk, just one small change. Try it for 1 week, just 7 days. Notice how it feels. Notice if you catch yourself spotting habits you would have missed before. Then come back and share your experience in the comments below. Tell us which habit you chose and how it's working for you. Your story might be exactly what someone else needs to hear to take that first step toward a safer home. If this video has given you practical information you can use, please hit that like button and subscribe to Senior Health Facts so you don't miss the next steps in your journey toward safer, healthier aging. We're building a community of informed, empowered older adults who are taking charge of their health one small habit at a time. Let me address the most commonly asked questions about fall prevention at home. Many people ask what exactly counts as a simple habit to prevent falls indoors. The habit we've focused on today is pausing before you step and scanning your path ahead. It's simple because it doesn't require equipment, training, or major changes to your home. But it's also remarkably effective because it gives your brain a moment to process what's ahead and gives your body a moment to stabilize before you start moving. Think of it as a mini check-in with yourself before each movement. Another common question is whether this habit really works everywhere, especially for those who live in a house with many rooms spread across 2 floors. Yes, absolutely. The beauty of this habit is that it travels with you. Anytime you move from one place to another indoors, whether it's down a hallway, upstairs, or just from your chair to the kitchen, you can apply it. The key is building it into each transition point. When you reach the bottom of The stairs, pause and scan before you start climbing. When you walk from a bright room into a dimmer one, pause and scan. The habit becomes your constant companion, protecting you in every part of your home. Some people wonder what to do if they feel dizzy or unsteady when they stand up and then start to walk. This is an important signal that you should talk with your doctor or physical therapist. While the pause and scan habit absolutely supports safety and can help you catch your balance, underlying issues like low blood pressure, medication side effects, inner ear problems, or vision changes may need professional evaluation. The habit works best as part of a complete approach to fall prevention that includes addressing any medical factors that affect your stability. People often ask whether lighting is really that important for indoor fall prevention. Yes, it's critically important. Mayo Clinic research shows that our lighting significantly increases fall risk because you simply cannot see hazards, changes in floor surface, or obstacles when the light is inadequate. Your eyes need good lighting to judges distances accurately and to spot potential trip hazards before you reach them. Think of lighting as a foundational safety tool, not just a convenience. Many seniors who get up frequently at night to use the bathroom wonder if that makes them more at risk. Frequent nighttime movement does increase your fall risk for several reasons. You're drowsier. Your vision isn't fully adjusted and you may get in a hurry. This makes implementing the pause and scan habit plus good lighting and clear paths especially critical for those nighttime walks. Consider keeping a flashlight or installing motion-activated lights along your nighttime route. Never try to navigate in complete darkness, even if you think you know the way. Another question is whether this habit replaces doing strength and balance exercises. No, it complements them beautifully. Health partners and other major health organizations emphasize that strength training and balance exercises are crucial components of fall prevention. They help maintain the muscle power and coordination you need to catch yourself if you do stumble. But this environmental habit makes your home navigation safer while you're building that physical strength. Think of it as a two-part strategy. Build your body's capabilities and simultaneously reduce environmental hazards. Finally, people want to know what they should ask their doctor about fall risk during their next appointment. Here are 3 conversation starters that can help you get the information you need. First, ask your doctor this: given my recent changes in mobility, vision, or medications, what is my current fall risk indoors and what specific factors should I be aware of? Second, you might say, can we review my home environment together? I'd like your advice on lighting, rugs, cords, and my nighttime path to make sure I'm doing everything I can to stay safe. Third, consider asking, are there specific exercises, assistive device, or home modifications you recommend for preventing falls? In my particular situation, your doctor can evaluate factors we haven't covered today, like medication interactions, blood pressure changes when you stand, vision issues, or balance disorders that might need specific treatment. Now let me give you a quick comparison guide between what to avoid and what to do instead of walking indoors without scanning your path. Pause. Look ahead and scan before you walk every time. Instead of having dimly lit corridors and rooms during movement, use adequate lighting and nightly along all walking paths instead of leaving rugs, cords, toys, or cluttering common walking areas. Keep walkways clear and remove or properly secure all rugs and cords instead of assuming you know your home so it's hazard-free. Do a weekly walkthrough of your main paths and check for any changes. Instead of getting up and walking at night without planning, use the pause skin habit, especially for nighttime movements. With good lighting, and instead of relying only on strength training or balance exercises, combine your home's safety habit with exercise and strength balance work. Let me walk you through your daily routine for fall prevention. In the morning, when you first get out of bed, pause before your feet touch the floor. Look at your path to the bathroom. Use your nightlight or bedside lamp so you can see clearly. This sets the tone for mindful movement throughout your day. During midday, as you move around doing daily activities like preparing lunch or doing light housework, practice your pause and skin habit each time you transition between rooms. This is when the habit becomes automatic because you're repeating it multiple times in low-stress situations in the evening before you settle in for the night. Do a quick walk of your main paths. Pick up anything that's been set down during the day. Check that your night lights are working. Clear your path from bedroom to bathroom one more time. This evening routine prevents nighttime surprises. As a bonus habit, once a week, invite someone to walk through your home with you, or do it yourself with fresh eyes. Look for anything new. A shifted rug, a moved piece of furniture, a new cord. Address it immediately, not later. Save this guidance. Print it out if that's helpful. Share it with someone you care about who might be at risk. These simple changes, practiced consistently, can make the difference between a safe home and a dangerous one. The information in today's video is based on current research from trusted health organizations. The National Institute on Aging published Preventing Falls and Fractures in 2022. This comprehensive review highlights the importance of home modifications, including grab bars, proper lighting, and clear walkways, and reducing fall risks for older adults living at home. Yang Y and colleagues published Self-Management Experiences in Fall Prevention Among Community Dwelling Older Adults in 2024 through PMC. This study explores how older adults successfully manage their fall risk through simple home-based habits, showing that personal safety practices can be highly effective. Hashimoto's published Preventative Approaches to Falls and Frailty in 2025 through Science Direct. This work reviews multiple interventions addressing environment, strength training, and behavioral habits that together reduce fall risk in frail older adults. Washington University School of Medicine publish a fall prevention program can help reduce harmful in-home falls by nearly 40% in 2021. This demonstrates real-world effectiveness of home modifications and habit changes for fall prevention in community dwelling. Seniors. Mayo Clinic published Fall Prevention: Simple Tips to Prevent Falls in 2024. This describes evidence-based approaches including reviewing home hazards, improving lighting, maintaining physical fitness, and regular vision checks as key protective factors for seniors. These sources provide the scientific foundation for the practical habits we've discussed today. If you'd like to read more, links to these resources are available in the description below. Now, before we wrap up, I want to remind you of something important. Everything we've shared today is for educational purposes to help you make informed choices about your health and home safety. I always encourage you to work with your doctor or healthcare provider before making any significant changes, especially if you've had a recent fall, if you're experiencing balance problems, vision changes, or if you take medications that might affect your stability. Your healthcare team knows you're personal health history best and can guide you on what's right for your specific situation. Every person is unique and what works wonderfully for. Judith might need small adjustments for you based on your individual health conditions, medications, and home environment. Your doctor or physical therapist is your best partner in creating a complete fall prevention plan that's tailored specifically to your needs. Take care of yourself, move mindfully through your home, and I'll see you in the next video where we'll continue building your foundation for healthy, independent aging.